Okay, and we're back. We're going to proceed with the patent video. Okay, so now we're at several attempts have been made to reduce the amount of hospital-acquired infections. This is page 5 of 67. Okay. Within, I don't know how to pronounce his name, so excuse me, but H.E.R and H.E.R's invention, U.S. Patent 7,908-153. I found that laboratory test results are given to workers performing infection control upon admission. Unfortunately, new clinical findings, patient progression, and clinical determinations are not triggered to release the workflow process. Patient progression, meaning if you initially get all the laboratory results on a patient, as soon as they hit the hospital, of course they're sick, everything's going to be elevated, fever, everything. However, as the patient progresses, it does not track that. So, B, to elaborate further, inconclusive results are not addressed within the workflow process. This invention fails to cover imperative basis and it is incomplete in functionality. C, as seen in technology gaps, lack of information and inconclusiveness disrupts data transmission process. What if there are inconclusive test results? Then what are you going to do for the process if it's all, just automated response? D, a solution is needed in order to allow testing results flexibility. Automated responses are outdated and lack responsiveness for individual needs. This is the same thing if you were to go to a restaurant and order your hamburger the way you like it. Might need modifications to it. It might be out of hamburgers. If you just press the button and said hamburger, a hamburger would pop out. That would be an automated response, pressing a button or, taking an order and issuing a sandwich. However, we have customer service. I think customer service is important. We're not robots, so we shouldn't, roboticize healthcare. It is proven that automated responses are outdated in healthcare environments due to the allotment of inaccurate automated responses based on inaccurate laboratory results. It is to be understood that this follows for patients that are in need of a workflow process but have not yet received laboratory results. If you have laboratory results pending, you still need to apply treatment. If we rely on their laboratory results in order to start with a workflow process, then you'd have patients who are not getting immediate treatment. This is especially important in the case of sepsis, which is on my video that I had on my YouTube, from my YouTube channel on Lex Enterprises Incorporated, on sepsis and hospital-acquired infections. Prior art fails to identify the exact task executed upon receiving laboratory results. In U.S. publication 201-83397, Brusset, Heimel, and Laborde failed to supply benefit for measuring the incidence of hospital-acquired infections. This method does not address wireless access. Remote is not clearly defined in the context to imply wireless connections or devices. So, now, advantages. Accordingly, several advantages of one or more aspects are as follows. To provide additional information and resources that prevent misinformation, disruption of processes and procedures, and technical difficulties that provide equipment with detailed sterilization methods and techniques that are accompanied by proper sterilization tools for adequate disease transmission reduction, that provide substantial results contingent with recommendation guidelines from the EPA and the FDA, clinical resources for MSDS charge, maybe a chemical hotline, a chemical resource hotline, clinical and customer feedback support and improvement, statistical analysis, and ultimately tracks inventory, monitors, verifies sterilization techniques, and diagnoses medical devices based on pathogens present on the medical device. That will keep track of the progression of the patient and use of a potentially contaminated device, which acts as a vector of transmission due to previous patient exposure with now absent symptoms and pathogens that will prevent the possibility of reinfection 48-hour readmittance period of a patient of prolonged stay, and use of contaminated devices. Thus, there are several other advantages of one or more aspects that will be apparent from consideration of the drawings and issuing description. Okay, so that's what that's under advantages. Okay, on page 6, that's what I feel that if I had to say in one sentence what my H.E.R Verify application would do once I construct it. So we're going to screenshot that because that's my note card. In summary, in accordance with one embodiment, a Department of Patient Equipment Usage Tracker comprises of a system having an H.E.R Verify equipment patient room admission verification process to set to reduce the amount of hospital-acquired infections and monitor, supply, track, and sterilize medical devices. H.E.R Verify equipment patient room admission verification is to be understood and recognized as H.E.R Verify. Okay? In the drawing, closely related figures have the same number but different numeric suffixes. Okay, so we have figure 1. So I'm going to do a side-by-side visualization for you for the figures. Okay, we're going to get this to show excellent here. It's perfectly aligned here. Okay, so this is figure 1. Figure 1 shows a summarized aspect of a function-based application in accordance with 12 embodiments to supply the base of the application for the prospective plan view of a network data integrated system between related programs over a secured network. So basically, you have H.E.R Verify, the Department of Patient Usage Tracker. You have, let's see if this will show. Oh, laser pointer won't work on that. It'll work on the wall though. You have equipment sterilization, equipment history, H.E.R, equipment error guide, department bed sterilization tracker, patient new equipment activity, patient census data, edit patient equipment, patient inventory, H.E.R Verify, discharged, equipment history, assigned equipment history, and equipment locator. So you basically have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, I'm sorry, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you have 10 features, 5 on each side. Okay, and I said over a secured network. This is the secured network here, and there's an H.E.R verified patient room verification information transmission process. The health organization database goes to a virtual private network or corporate network capability, and then that's integrated into SNIDS, SNIDS, which is a H.E.R Network Integrated Data System Server Access Point. Then here you have the code protected digital security key. This is the nurse and doctor and technician access with the personal identification, username, access code for person, health information protection, and it's on a Wi-Fi 3G, 4G data network plan for making phone calls, receiving real-time data, and that goes into SNIDS, the Secure Network Integrated Data System. Figure 1A is a description of the definitions for the equipment user tracker for better use and comprehension. So we go here. This is the definition of each one. So, as you can remember here, equipment sterilization history. What that does is this app is designed to monitor the time captured between equipment cleaning and patient usage. Meaning, if you use a Lysol, it recommends like 10 minutes contact. Meaning, just because this patient, and we're in overflow and it's a crisis, we can't just wipe it down with a wipe and put it right on the patient and just let it air dry real quick. It has to have the right contact time and aeration period for the chemical to work. So it's going to ensure that there's adequate time, aeration period, in between the time that the equipment was cleaned and aerated and the time that it was put on the next patients. H.E.R Equipment Error Guide provides potential equipment misuse errors as preventive measure guideline. So there's several errors that can occur, like a same name alert or an infection control alert, real-time data. Departmental patient sterilization tracker, okay, right here. Tracks the sterilization and patient assignment of hospital beds and mattresses. Many patients come in and they're maybe elderly and can't turn and rotate enough, so we have the decubitus ulcers, so we have TheraTurn mattresses available for them to rent, and they can, get the turnover that they need, or bariatric beds and things like that. Already accommodating, already ready, and already sterilized in the hospital and storage. There will be no mix-ups with bed barns, whether equipment is clean or dirty. It'll be managed separately by H.E.R verified technicians. Okay? Patient equipment new activity. That provides a database for new equipment and assigned activity. This already exists. However, the uniqueness of this app function will provide the exact timestamp of the patient equipment assignment, the equipment discharge timestamp, the equipment sterilization personnel in timestamp, who assigned it, who cleaned it, the nurse attending the room, the doctor attending the room. Mandatory sterilization time recommendation before processing to a new patient. So, making sure the sterilization periods are met. Patient census data. Tracks the patient census data as it directly corresponds to the availability of equipment. Keeps a steady availability of equipment to lessen the potential misuse of equipment. Validates equipment patient room admission verification process, H.E.R verify. So, we'll be keeping track of patient census, patient volumes, influxes, like statistical charts and data, available equipment, equipment that's highly desired or most commonly desired. So all the statistical breakdown behind that, and correlate it to the patient. So if we have a crisis and there's a particular piece of equipment being desired, we can premeditate all those devices getting sent over. For example, there's an incident where they needed a pediatric tool, a pediatric chest tube. The hospital didn't have a pediatric chest tube, so he had to make one, okay? So, for example, if there's a school shooting, well, you may need pediatric chest tubes at that facility because you can't use an adult chest tube on a child, okay? So, that's the example of tracking the equipment volume and the patient volume. Not just how many patients are in the hospital. We got to make the correlation between patients and the equipment that's available. Okay, and the type of patient, pediatric, elderly, adults. Okay, especially ICU. You also look at it by department. You know, what ICU uses a lot of ventilators, things like that. Patient new activity. Okay, provides a database. Equipment new activity. Provides a database for new equipment assignment activity. The uniqueness of this app function will provide the exact timestamp of patient equipment assignment, discharge. Okay, I read that already. Edit patient equipment. Permit any assignment errors to be corrected. So, not only will we stop the infection control violation, we'll also correct it. And then it will be only authorized by attending nurse as a safety precaution and infection control prevention measure. So nurses get blamed for infection control, and doctors also get blamed for infection control violations. So we want to make sure that if there's an error that comes up, the nurse authorizes the correction to prevent that. So it's kind of like an instant gratification reward. Oh, I have an error. You go to your nurse, you go to your doctor, they authorize it, and you fix the error. So basically, you're locked out of your system until you correct the error for that patient. If that nurse is not available, then you've got to wait, okay? That's why you're going to have a whole team of people to address everyone, okay? But we're not going to just ignore infection controls or override them or override or just override, ignore. You stop right then and there, and you take that equipment out of that room and put it on the right room. If it's the same last name, same first name, you mixed it up, that's going to catch that based off their serial number on the barcode bracelet, and you'll know, right? You stop right then and there, and you fix the error, and the nurse goes on ahead and types in her authorization. That you both caught that infection control, because she gets credit for it because she's keeping track of her patients and keeping their bracelets and making sure all their equipment has the right stickers and everything on it, and bracelets and identification and HIPAA on it. You're doing your job by making sure that you stopped before you assign something or remove something for a room or whatever, or an error, or you got an error alert when you try to assign something real time before it got blamed on the nurse. So it's a team effort. Patient inventory, H.E.R verify. Okay? So that's here. ER overview of recent activity. The ER is a high volume area. We want to keep track of the ER because that's where people get put in their position where they're going to be in the hospital. That is the number one way that you enter a hospital. Okay, so you enter the hospital and you look at the overview of the recent activity. This is going to be your estimator for how many pediatric, how many elderly, how many ICU, how many surgery, how many outpatient, and it provides a snapshot for high volume admissions. High volume is not just specifically the whole hospital is full. High volume could mean that whole department is full. So for example, if you go to Walmart and you go to customer service, the whole customer service line could be full, but all the cashiers could be free. Well, only customer service does return, so that's a high volume in that particular department. Okay, if it's Christmas time and everyone's buying electronics, there's high volume in the electronics section. Okay, the jewelry counter may be clear. So when you're thinking of a snapshot of high volume admissions, the whole pediatric floor, the entire labor and delivery is full, med-surg is full, ICU is full, volumes specifically, not just the overall hospital. That's what I mean by snapshots for high volume admissions, okay? Because remember I used the word ER overview, your whole overview, and then snapshots for high volumes, departmental. H.E.R verify function, patient rounds activity for documented equipment, patient room admission verification. Okay, so you're going to document your rounds, and also the nurses and doctors are able to add notes for any inconsistencies that they see. The H.E.R verify technicians, I don't know if it's within their scope as of right now to be able to put notes and comments. I think that should be strictly for the doctor and the nurse, besides the attestation, but for EMR records. However, I don't think it's a problem for a technician to communicate with the nurse about an issue, and she can put that in the correct medical jargon with the correct science, anatomy, organic chemistry, you know, what she knows about her patient in detail from the patient's testimony to be able to put notes and comments. That's specifically from the doctor and the nurse. I think if the technicians get to put in comments and notes, they're not having enough face-on-face interaction with the patient, and they don't know enough about the patient's medical history to put notes in there. But the activity will be documented. Okay? And then in here we have okay, this allows the opportunity for the staff to provide a periodic follow-up on current departmental patient equipment assignment statuses. Okay, next we have discharged equipment history, discharged patient history. Allows an overview of recently discharged patients and corresponding equipment, ensures that measures can be taken to provide appropriate and immediate sterilization to equipment not in use. So here I put discharged equipment history as it's a typo there, but it should be patient equipment history. Alerts for ER departmental equipment not sterilized within 24 hours. If you have a bloody IV pump from gunshot wounds, and it's we don't want to let that sit in the sterilization rooms or the decontam or the contamination closet or the soil utility closets for more than 24 hours, because bacteria begins to colonize and spores begin to develop. So it's about taking immediate action. That's why they need their own separate team for managing these devices. Okay? So, now, discharged patient history. Allows an overview of recently discharged patients and corresponding equipment. Ensures that measures can be taken to provide appropriate and immediate sterilization of equipment not in use. Alerts for ER departmental equipment not sterilized within 24 hours. Note, ER has a consistent patient turnover rate, therefore it allows more susceptibility for infection control violations to occur and the reproduction of pathogens. Alerts are put in place to monitor consistent, timely sterilization of commonly used equipment. The direct underlying benefit is that it will prevent soiled equipment from sitting for long periods of time and allow more time for focusing on patient needs opposed to searching for available equipment. This also cuts the cost of having an overshoot of equipment in the hospital due to a lack of diligence from timely equipment processing. Okay? Assigned equipment history, which is here, allows for categorizing of equipment by PHI protected patient name, by time, by date, by nursing department. An equipment locator, searchable by patient name, equipment type, allows for patient assigned equipment to move with the patient during departmental relocation. Alright? Also during temporary separation from assigned equipment for diagnostic and scans. A lot of times they'll disconnect them from their equipment, they'll be sitting in the room. The patient, you may say, well, did they leave, or is the patient just in radiology? So we'll have a locator which kind of tell you where they are. So last is the telephonic access sanitation guideline hotline. Questions pertaining to chemical and patient safety. Brufen is a chemical known to be harmful to infants. Technicians can seek assurance and reference from qualified personnel. Hopefully we can coordinate with the CDC to get a number to call for all the technicians if they have any questions on chemicals, along with the EPA and the pathogens for the CDC, EPA for the chemicals, and FDA for any medications or allergic reactions, things like that, the poison control, all those numbers be available in their device. The MSDS chart analysis material safety data sheet right on hand. Just as you start searching in Google, it pops up. If they're using a specific equipment, they want to know the shelf life, they want to know the concentration, they can just type in that chemical agent and get all the information. Hopefully that'll be coordinated through the EPA because they update regularly. They're really good about that.